Hi guys, good morning. It's Dr. Denney over at Four Paws at Fulshear. Today I'm going to be talking to you about feline/cat preventative care. And joining me today is my Cavalier King Charles dog, Aspen. She's my baby. She comes to work with me, so she's going to join in. Maddie's going to help me by asking some questions to get us started.
Dr. Denney, what is considered preventative care for my cat?
So preventative care is the same thing as it would be in humans. Like, why do you brush your teeth? You brush your teeth so you don't get cavities. So it's going to be along the same lines as that. But for preventative care means we're trying to catch problems or prevent problems before they occur, because then not only is it cheaper to fix, but it's cheaper to not have those problems happen at all. So preventing like fleas and ticks is one. So being on flea and tick prevention if your cat's going inside and outside. Heartworm prevention in cats is just as important as it is in dogs. So preventing heartworm disease in cats. Cats are also really prone to, as they get older, they're prone to certain diseases like arthritis, and cats are masters at hiding their illnesses. So I'm going to be very guilty of the fact that my 13-year-old cat, he just started slowing down, and I didn't really notice until he stopped sleeping with me. And I started paying attention and started noticing that, oh, he's like, instead of jumping all the way down off of something in one go or all the way up on something in one go, he's going like from here to here to here. And that's a sign of arthritis in cats. So like preventative stuff, so subtle cues that a veterinarian will pick up on and ask these questions that owners might not. Dental care. Okay, pets get dental disease just like we do, and because we don't brush their teeth as often as we should or do maintenance dental care, even though it is recommended, those exams are so important to catch dental disease early, because dental disease can get quite expensive to treat. Those dental procedures, especially if you're extracting and doing oral surgery or bone grafts or drilling, it can get really expensive. So making sure that we're looking at the teeth and taking care of them is going to really help. Nutrition, so making sure that your cat's on an appropriate diet. Kittens are going to be on kitten food. Adult cats are going to be on adult cat food. Making sure if you have an overweight kitty that you're on a weight management plan, because obesity in cats and dogs is a real problem. Their joints break down faster than ours do. So having that pressure on their joints when they're overweight is going to make them weigh a lot more. This little girl's on a diet right now for that exact problem. And it's much easier to prevent the weight gain than to try to get the weight off. It's kind of like, in my experience, personally, human women, we have a harder time losing weight than men. My husband can drop 10 pounds in like 4 weeks, and I'm sitting here struggling with 2 pounds every 4 weeks. Like that's difficult. But preventative maintenance is going to be things like that. Now, preventative care is also going to include, running lab work on your pet or on your cat once a year. We strongly recommend these preventative wellness programs because catching liver or kidney disease or urinary tract infections before they're, symptomatic is going to make the difference on how easy is it to treat, how cheap is it to treat. Can we do outpatient care versus aggressive medical intervention? So for instance, I had a kitty cat last week that came in with elevated liver values. But the cat feels fine. The owner had no idea there was a problem. Neither did I on a physical exam. We caught it on routine lab work. That cat was only 10 years old. Now imagine if we hadn't caught that. It might have turned into another patient that I saw, when she was 13 or 14, and she came in jaundice or yellow from liver failure, and she was at the emergency hospital for like 5 days. They spent thousands on care. Imagine if we would have caught that early. We would have been able to intervene. So a lot of this is all about preventing illnesses before they happen. It's the same reason why we get vaccines. Vaccines prevent illnesses. Now, they're not 100%, but if you do catch the disease, or if they catch the disease, it's going to be a shorter, less severe course of disease because that immune system's already prepped for it. So preventative care is exactly what it says. It's prevention. We are trying to catch things early or prevent things from happening. That way our pets can live longer, specifically our cats.
What are some risks of failing to provide preventative care for my cat?
So with cats, they don't tell you that something's wrong until something's really wrong. They are masters at hiding illnesses. So one of the first few things that you might notice is maybe we're not eating so well, or maybe we're only eating out one side of our mouth, or we're dropping kibbles and not chewing them completely, and the bowl is full of all these like broken pieces of kibble. That's what one of my cats was doing when his mouth was hurting. That was how I knew. But it's, you know, when they hide their illnesses, that means that we're not going to know something's wrong until, you know, we're vomiting multiple times a day, or we're dropping rapid amount of weight. And these are things that we can prevent. You know, we don't want to wait until it's a grease fire we're trying to put out. We want to put out, like, you know, a little baby fire. Baby fire is a lot easier to manage than a grease fire.
Why is it important to avoid self-diagnosing my cat?
Because what if you're wrong? There are so many clients that think they know what's going on, and they may have had cats, you know, their whole lives, and so symptoms can mimic each other. For instance, drinking more and urinating more is a symptom of kidney disease, but it's also a symptom of a urinary tract infection or diabetes. Dropping weight rapidly can be a symptom of diabetes or cancer, but it's also a symptom of a disease called hyperthyroidism, where the thyroid goes hyperactive in cats. So you might think that you know what's going on, but if you're wrong, because you don't have the capability to do some diagnostic testing, but if you're wrong, your cat's going to get much worse much quicker, and then it's going to be a lot harder for us to turn things around if we can at all. You know, sometimes we get these cats that, you know, owners think they've done their best, and they are. In their heart of hearts, they truly believe that they know what's going on with their animal, and it's not for lack of love. These owners love their pets, you know, and sometimes they're wrong. And by the time they come in, because they get an inkling that, hey, you know, what might have worked in the past isn't working, we are now fighting an uphill battle, and sometimes we lose that battle. My job is to try to make sure that that doesn't happen, that we catch these conditions when they're treatable, when they're preventable. That way we're not, you know, potentially having to deal with saying goodbye to one of our beloved pets. Thanks so much, guys, for joining me on this video. Stay tuned for our next one.